समाज में जो लोग वैक्सीन के खिलाफ गलत फहमियाँ फैला रहे हैं, इग्नोर करके हमको सबको मिलकर वैक्सीन को बेहतर सुरक्षा के लिए इस्तेमाल करना ज़रूरी है।
વેક્સિન લેશું, વેક્સિન સુરક્ષિત છે, બધાએ વેક્સિન લેવું જોઈએ અને કોરોનાનો અંત તો જ આવશે।
भारत की मेडिकल टीम और सभी साइंटिस्ट के लिए मेरे मन में बहुत आदर और सम्मान है। उन्होंने बहुत मेहनत करी है। इंडिया में जो वैक्सीन बनी है वो सुरक्षित है।
Hello everyone, you're watching News Epicentre with me, Marya, Shakil. As the vaccination drive gains momentum across the country, inoculating everyone is the only way that we have, and that is the only way we can save ourselves as a nation against the coronavirus. However, because of rumors and petty politics, many doubts are swirling around the vaccines, namely questions over data and concerns over side effects. The experts have made it clear that these vaccines are safe and effective. The government is roping in influencers and celebrities to boost its pitch for mass inoculation, while Prime Minister Narendra Modi will take the vaccine jab in round 2 along with chief ministers and members of parliament who are above the age of 50. This is aimed to boost confidence across the country so that citizens line up to get the jab and move towards making India a COVID-free nation. There are more vaccines in the pipeline which are being prepared for rollout after Covishield and Covaxin, while the heavy lifting of the rollout strategy is taking place in the states. As per experts, the same vaccine will have different efficacy rates in diverse populations. Experts are suggesting focus should be on clusters and localities where the case fatality rate is high, namely in urban areas as compared to rural India where the transmission rate is low. While the infrastructure is being tweaked, a robust effort has to be made to counter misinformation and rumors surrounding the vaccine. At the same time, experts are suggesting that India should prepare itself for fighting pandemics akin to COVID-19. The vaccine drive in India began on January 16th, 5 days after the rollout. With over 8 lakh Indians vaccinated, what can be done to ensure citizens have the confidence in the vaccine and are ready to roll up their sleeves? Joining me on the show, Guru Prakash, he is the spokesperson of the BJP. Madhu Yakshi Gaur is the spokesperson of the Congress. We have Dr. Devi Shetty, chairman and founder, Narayan Hridayalaya. K. Sujata Rao is former health secretary. I'm going to begin with you, Dr. Shetty. You are among those who have taken the shot. Can a relatively slow inoculation process be attributed to vaccine hesitancy, or is it the sheer size of the challenge that India with its large population poses?
It's essentially anything you want to do in large scale, it has to start slowly, because you need to put the process in place and people should know their duties and responsibilities, and the software should work. Many things has to be in the right place. So the pace at which vaccination is happening is anticipated, and it is a right pace. We shouldn't hurry it up. Yeah, I agree with the pace at which it is being rolled out.
And Dr. Shetty, since you took the jab, are you feeling all right after 5 days?
After the jab, I did one major operation, and every day I have been operating, and I'm seeing at least 50 to 70 patients every day in my clinic, as if nothing has happened. Not only me, all my colleagues of my age have taken it, and they are back to normal without, none of us had any problems, none of us.
Okay, Dr. Shetty, you know the disease burden is higher in southern states, and they also have a higher proportion of elderly. Is this reluctance coming from the urban or rural pockets?
I don't think there is reluctance. I really don't think there is reluctance. It is a matter of putting all the infrastructure in place for making it happen. And also currently we are only giving it to the doctors and hospital staff. So the number of the people employed in the health sector is too small, and the number of people who are now vaccinated is huge. It's into 8-9 lakh people. And I don't think we are moving slowly. And we anticipated this space.
Okay. Before I go to Sujata Rao, Dr. Shetty, what we are told is that the Prime Minister and the Chief Ministers of states who are above the age of 50 will be inoculated in the second phase. Do you think this is part of a communication strategy that the government has devised, and this is the step in the right direction, because that will give more confidence to the people if their political leadership of the country actually take the jab?
That is the right thing to do. Before I could tell any of we have about 20,000 people working in our organization. I am perhaps one of the oldest person, and I told my colleagues, I'm the one who's going to take it first. And you look at me and follow me. So it is very, very important that the leaders must set an example. Otherwise, they have no right to ask others to get vaccinated.
Okay. Dr. Shetty, I'm coming back to you in just a moment. Is it because of cold chain points? Sujata Rao, you had highlighted in your recent piece that 8 states in the north and Odisha account for over 40% of the country's population and have only 28% of the cold chain points.
That's right, yeah. And more than half are concentrated in the southern states and Maharashtra and Gujarat. So there is an imbalance between the north and the south in terms of infrastructure.
So are you in agreement with what Dr. Shetty is saying, that the pace at which the vaccination is happening in the country is right and it should not be expedited?
No, I'm not saying, I don't know whether the pace is right and need not be expedited, but I'm saying, but what he had said earlier, that when you're doing a large program, it's not like you're distributing rice, or clothes where hordes will come and stand in the line. There is cautious optimism. You have to give and allow people to look and decide for themselves. After all, it is an invasive procedure. So they have every right to be cautious. So, these kind of new technologies and it's a new intervention. There is always that element of time when people see, watch, observe, and then the take on comes after. I mean, this is nothing unusual. This happens every time we introduce anything that's new. And secondly, the timing also matters. Maybe the response of the people would have been different had this vaccine come in September, for example, when the infections were peaking. Right now, we are on a downward swing. And many epidemiologists have opined that maybe the infection is on its way out. So that could be another reason why people are saying maybe we don't need to take the vaccine. We saw that also happen in the H1N1 pandemic, when by the time we could get our act together and get the vaccine out for the health workers, the H1N1 was going off, So the offtake was very low. So sometimes the timing, and then thirdly, this vaccine program was born in controversy. There was so much of, some extraordinary decisions were taken. Okay, you might justify it saying it's an extraordinary situation. And the trade-offs showed that it's better to go ahead and introduce the vaccine rather than wait for the full trial protocol to be worked out. That's a decision taken. That's a risk taken. That's okay. But the people, the hesitancy should be expected, because then people will say, well, then there's no efficacy. Let's see and watch and see what's happening. So I think it'll really pick up soon.
Okay.
But I think we have to be a bit patient instead of pushing people, because the more you push, the more doubtful they get, saying, why are we being pushed?
Okay.
And by pushing is giving threats, I'll withhold your salary, I won't promote you, or I'll beat you up if you don't. I mean, this kind of threats and all is not it. Give time, and I assure you people will respond well.
Okay, so give time to people, because it's been just 5 days and 8 lakh already inoculated. Madhi Yakshigod and Guru Prakash come in now. We'll be going back to the experts in just a bit. Madhu, opposition is constantly trying to seed doubts, I would say, with respect to the vaccine, when the world at large is acknowledging India's leadership and vaccine diplomacy. What is it that the world is recognizing that opposition is not seeing here in India?
We are a responsible opposition, Marya. After independence, the modern India has seen the universal immunization program started way back in 1951. You have seen the vaccines for polio, to TB, to leprosy, to measles. There's so many other vaccination being started in India. In 1985, that universal vaccination program were containing to 6 diseases which many of our families have faced it. I lost my sister and engaged in 1962 because of smallpox. So what we are seeing here, opposition, we are being irresponsible. What questions we are raising is, one, who, how, when, where the people of India are going to get vaccine. Look at world, look at USA. The president of the country has taken in the first phase to build the confidence among the people. This vaccination is good for the people. Here, the Prime Minister of India, why can't he take himself first? Here, I just heard Dr. Shetty is heading in a 20,000 organization, and he said first he took the vaccine to build the confidence among his employees. Why can't the first citizen of India can't take it to build the same confidence? Is it wrong to an opposition to raise this?
Okay.
Is it not
Guru Prakash, respond to
vaccinations
that.
developed earlier by the governments earlier? Is it not Indian scientists who
Marya,
helped
Marya, I think
building,
that is a very
developing a
misplaced
vaccination, Bharat
argument.
Biotech?
Let me-
Why their
let me tell you that
price
it is a
difference
very
here?
remarkable moment
Why
in
can't,
the history of our
why
country.
can't, why government of India buying for extra price?
Okay.
No, I think the question is for me, sir. I think it is a very remarkable moment in the history of our country. The structural flaw with the Congress party is their cynicism. You see, when the Supreme Court gives a judgment which is not according to their taste, they raise question on the Supreme Court. When the surgical strike
Let's stick
happens,
to
they
the
raise question on the
vaccination.
army.
You talk
When
about-
they lose the election, they
Why
raise
can't
question
you
on the
stick to
Election
the
Commission of India.
vaccination here?
The
We're
problem is
discussing
with
the
the thinking of
vaccination,
the
not the
Congress
Congress
party.
party here.
Now, let me tell you, the remarkable and the stellar leadership which the Honorable Prime Minister has displayed the entire period of pandemic, be it the advanced imposition of lockdown, be it the banning of international
You know,
flights,
Madhu, the
be
question
it the
is
Pradhan
also
Mantri Garib Kalyan
that who
Ann
really
Yojana.
seeded this confusion? Didn't it not begin with Akhilesh Yadav saying that this is BJP vaccine? The question is, when Bharat Biotech CEO and CMD does press conference and explains that they have legacy, that they have data to showcase that everything went as per protocol, then if that kind of doubt is raised on the day vaccination drive begins and it continues to be raised in the last 5 days, then how do you expect people at large to come out?
Yes, you have right question you asked, Marya. घंटा बजाने से, दिया जलाने से, जो try to educate the people of India by Honorable Prime Minister, go Corona, a responsible central minister doing this campaign. Is that what a responsible citizen, people in the government doing this kind of nonsense? And secondly, you asked Bharat Biotech, how many people? 800 people tested. How much test has been done? Okay, fine. Even if that is accepted, who helped the Bharat Biotech to develop this vaccine? Is it not ICMR scientists?
Yes.
Then AstraZeneca, they're distributing.
So you
it
don't
at
have
price
faith in your
200.
own indigenous
What we are
vaccine?
asking, why the government of India is paying? So second question, I answered that. You saying Akhilesh Yadav questioned this BJP vaccine, whatever. That's not the Congress party questioned it. Congress party respected the scientists who developed, and
Okay,
the people of
Guru,
the
respond
country
to
is
this,
indebted
please,
to the
quickly.
scientists who developed it. And Bharat Biotech,
no.
what they are doing it,
No,
instead
whenever
the
you-
Bharat,
whenever you
BJP
raise such a
spokesperson
baseless
answering this,
allegation,
is
it
going
is an
on
insult.
accusing the
It is
Congress
no,
thing.
I
Is it
did
not
not
Congress
listen
government
when
in
you were speaking,
1962
sir.
to
Please have the
85
patience to
to
listen
all
to
these
me.
years who developed
we
vaccine?
can have a
Did we
shouting match,
boasted
Marya.
about it?
If you
Did
can
we made an
control
event
it,
management?
you give the chance to
What we
me,
did, this is an impartable milestone for the government in the service of the people to develop a vaccine
you
and look
speak
after
first.
people's
We
health.
don't have this habit. We are representing the world's largest political party, and we have the decency in a debate.
Go ahead, Guru.
Let me. Please have the patience. Yes, sir. No. You see, Marya, the problem with the Congress party is that they are at a lack of vision, lack of imagination, lack of leadership. The Prime Minister today itself has tweeted that tomorrow he will be interacting firsthand with the vaccinators, with the people who have been received the vaccine. So I seriously don't understand this law. The entire neighborhood, Bhutan, Maldives, Malaysia, Bangladesh, they are seeking our cooperation in terms of vaccine. They are not able to appreciate this. This is a moment when, regardless of our political opinion, regardless of our political differences, we should come together and celebrate the contribution of the
Okay, let me
research
bring
fraternity
Dr.
and the
Devi
scientific
Shetty back
community.
now.
By
Dr.
constantly-
Shetty, we don't know, there are certain areas that we are still trying to find answers of, and which is, of course, does this vaccine provide protection for life for a year or 6 months? Its efficacy among the elderly or the very sick of it, stopping new infections. How important is it that the government's communication strategy conveys all those aspects?
The efficacy of a vaccine has been proven in the clinical trial, but only time will tell which is better. So far, all the evidence shows that these vaccines are effective for the job what it's been asked to do. I think if we start questioning the efficacy of the medicine which is accepted by the standard norms and the standard methodology, then there is no proper answers. So I have no doubt. I'm not a vaccine expert, to be honest with you. I believe in science. I believe in the methodology of the way the vaccine has been developed, and I trust the system. That's all I can say. I'm confident this vaccine will deliver. I have no doubt about it, because India has the heritage and the legacy of making vaccines for the whole world. So we have experts who have been doing it for decades. So I have no doubt that the product what they have come up with will be effective.
Okay, Sujata Rao, you wanted to respond to it.
No, I'm just saying, that I beg to differ with Dr. Shetty. I normally don't, but I think this time, the whole controversy, let's, Marya, keep politics out.
Yes.
Look at the case. And the facts which acknowledged by government itself. What was the extraordinary decision taken, because it's an extraordinary time, is that phase 3 trials have not been completed by Bharat Biotech. What is an efficacy? That the safety has been done, and safety and efficacy is what is tested out on a larger sample of 30,000 respondents in clinical trial phase 3. And what does efficacy say is exactly the questions you have raised. How many months will it give immunity for us? Who are people? Which age group will it benefit most? And all these. Now, so can anyone say that the Bharat Biotech co-vaccine will give us 50% immunity or 30% immunity? That's important, because let us, for argument's sake, say it gives only 40% immunity. That doesn't make it a bad vaccine. It only means you have to continue to wear, because it's 60% vulnerable. So you must not give up your behavior of wearing masks and keeping a distance from crowds and take safety precautions. Now, that's a very important guideline. So, because vaccines are not 100% foolproof and are not the only way to protect you,
Yes.
So, efficacy has a certain standing, and that ought to be done. But having said that, the regulator must have looked at the trade-offs of postponing the decision to introduce the vaccine by another 1 month, by when the efficacy results would have been out, and doing it now. I'm not privy to it, but we maybe there was some.
Sujata Rao, the timeline of trials have been compressed in other countries as well. It did not only happen in India.
In US, Pfizer and Moderna finished their phase 3 trials, and then only FDA approved for their use. And FDA has not approved AstraZeneca, even though they have finished phase 3 trials in UK, because they're still asking for some more data.
Okay.
They have not.
So, okay, come in on this. Since we are talking about, you raised an important point there, Sujata Rao, of if a healthcare worker has been vaccinated, should the vaccine also be given to his family, because he is prone to infection till the time he has not taken the second dose. Dr. Devi Shetty, one view is that does it make sense to vaccinate individuals in towns and villages where positivity rate is low? Dr. Shetty.
Yes, I believe that I couldn't hear the second part of your question, Marya. Can you just repeat it?
Yes, I'm going to ask it again. Because there are people and experts particularly who are talking about certain strategies or revisiting of the strategies. One view is that does it really make sense to vaccinate those who are in towns and villages where positivity rate is low? Because right now, beyond the frontline workers, identification is presently based on age and comorbidities rather than place of residence. Should that be seen?
I think everyone should be vaccinated, like what the current protocol is, mainly because you look at the states which did a fantastic job in preventing COVID spread, like Kerala. Kerala did a phenomenal job initially, but then what happened? They have one of the highest numbers. So nobody can escape. It is a matter of time. If they had a low incidence, God knows, who knows, they may develop it again. So my suggestion is we should follow a standard policy of vaccinating the whole country, because we are not staying in one place. We keep traveling. So the people, the person may travel, or his friends and relatives may travel, and it's a matter of time. If they had a low incidence, their herd immunity level is definitely low in that territory, and they are very vulnerable. So we need to vaccinate, because this is one of the ways where we can help developing herd immunity.
Yes, let me ask that question also to Sujata Rao. Should states focus on clusters and localities where the case fatality is high, or localities with high population densities?
You know, I would, if given the choice, I would try to triangulate the different sources of data. You know, the morbidity due to Covaxin, where it infected most, where it is circulating right now. I look at all that epidemiological data and try to rate or rank my priority areas, because, you know, everyone must be vaccinated, but certainly not, you can't do it all in one shot. So, you know, there's no point in going to Bastar where they've not heard of COVID at all and vaccinated everyone there, because the likelihood of them getting COVID is so remote. But say in Dharavi, they could, the UK strain may very well hit you, because there's much more of flow of population and density, and all those factors are there. So I think such a prioritization would have helped. And if you had taken area by area and had the saturation principle, it would have been easier to administer, because now the vaccinator goes for the health provider, then goes for the plus 50, then goes back again for the below co-morbidities. I mean, it's a constant repetition of the same cycle everywhere. So maybe that would have been another approach, alternative, that could also be examined. Nothing is lost, they can still do it. And that I think more epidemiological data should be the basis on which the sequencing of rolling out the vaccine
Fine
program.
enough. You know, because we have had universal immunization program, perhaps based on that experience and knowledge, this is about revisiting it. I'll give the final words to Dr. Shetty, but before that, 20 seconds to you, Madhu.
Quickly, what I understood by the experts, Dr. Shetty and a distinguished officer, former Health Secretary Sujata Rao, that everyone should be vaccinated, right? In that case, when Belgium, the AstraZeneca supplying for 158 rupees, why Indians in India getting government of India buying it for 200? If this question, and we getting a lecture from a gentleman from BJP, I don't know what is standing in public life, Congress need not to get a lecture from these people. Okay. Let him answer straight questions what experts are saying.
But here in this, yes, respond debate, to this.
Both Shetty and Sujata are saying, if this every citizen
about
of country need to be vaccinated, why the government of India paying more and buying it, taxpayers' money, why they're using it, criminally using it?
Okay, Guru
That's
Prakash.
a straight question. Let him answer.
Dr.
Instead of lecturing to the Congress what needs to be done.
And I really don't understand his disagreement. Before making any personal comments, sir, please do some introspection. Please do some introspection within your organization, because your organization is in a
You go ahead and do yourself.
Okay,
don't
so
lecture.
we will talk about
don't
the politics later. Let me give the final words to Dr. Devi Shetty. Dr. Devi Shetty,
on everything under the sun.
We have seen 5 days of vaccination. Politics, of course, will continue with the two politicians. Your final words.
My final words to everyone. At the earliest opportunity, when you get an opportunity to vaccinate yourself, do not hesitate. And vaccine is safe. It has been given for now lakhs and lakhs of people, and no serious major adverse effects. It is safe. Please take it. Because God knows we have no idea about the second wave. God has given us a window of opportunity. Please utilize it. And government has done a fantastic job in providing us the vaccine in such a short period of time. Please take the vaccine. That is my last word to every citizen of this country.
Please take the vaccine is the message coming from Dr. Devi Shetty. Sujata Rao?
Well, yes, I suppose you must take the vaccine, and I think Covishield seems to be having a greater priority among most people, most doctors. whatever it be, I think, well, you have to take it because they have said that it is safe. So you have to trust the system, I suppose.
Okay, all right, uh, Dr. Devi Shetty, Sujata Rao, Madhuyakshi Gordon, Guru Prakash, thank you so much for joining us. Of course, as the news is that the Prime Minister, the Chief Ministers of states who are above the age of 50 will be vaccinated in the second round. Will it give more confidence to the people? That remains to be seen. But overall, as far as the numbers stack up, 5 days of vaccination, over 8 lakh frontline and healthcare workers vaccinated. That's all from me. Thanks so much for watching.